Hi, my name is Latavia Grant. I am a level 4 vocational nursing student with Vista College, and I'm here today to present to you my capstone project, which I chose to do over type 2 diabetes and hypertension. I chose these two comorbidities because they are very prominent in my family and very relevant in the United States as a whole. They may not seem to hold in much weight in the medical field, but they are very serious if not treated correctly, and they hold very serious complications and even fatalities if not treated properly. I will give you a breakdown of my board before I go into details. On this side, I have a concept map presented to you from my patient, which has both of these comorbidities. This side is type 2 diabetes mellitus. This side here is hypertension. I have illustrations in the middle. This side here is my physical assessment. I have a psychosocial assessment, my medications, and lab values that are important to type 2 diabetes mellitus and blood pressure or hypertension. With type 2 diabetes mellitus, there are two types. In type 2, it is non-insulin dependent, which means that you don't necessarily need insulin. It can be controlled with oral medications or insulin if it's that bad, but if taken care of properly, this can be cured. You can get rid of this, or it can go away if you eat properly, exercise properly, and take your medication properly. Okay? With hypertension, which is basically high blood pressure that is always high, at least over 130, over 90 is considered high blood pressure that measures all the time. Here are the lab values on that. Actually, pre-hypertension starts between 120 and 139 over 80 and 89. And my patient presents with a blood pressure today of 136 over 88, which is about a norm for him until he gets his medication. These two comorbidities go together because they affect a lot of the same organ systems in the body. With your type 2 diabetes mellitus, it's mostly about your pancreas and insulin secretion and such forth, but that also plays a part in your kidney function and lab values and things like that. And hypertension is going to be about your blood vessels and the way they constrict and the pressure that it applies on your walls, which is affected majorly by type 2 diabetes. The combined impact of diabetes and high blood pressure can increase the risk of cardiovascular disease, kidney disease, and other health problems. 50 to 80% of people in the United States who have type 2 diabetes have hypertension as well. If you see one, you're most likely going to see the other. For my patient's physical assessment, his condition is pretty much under control with his regular treatment regimen put together by the doctors and nurses in his facility. But he does, have, like I said, type 2 diabetes and hypertension, and both of these things are so out of whack in the morning. So his medication regimen follows that. Type 2 diabetes, his blood glucose reading that morning was 146, which means he's going to get his regular dose of intermediate acting insulin. That's all he gets as far as type 2 diabetes mellitus goes. But both of these things are treated with proper diet, exercise, and just taking care of yourself the right way. Also, with the medications, there are certain medications he can and cannot take given the fact that he has both of these comorbidities together. For example, the type of blood pressure medication he takes, he can only be prescribed thiazide diuretics, in which he's taking hydrochlorothiazide for his blood pressure, and he can only be prescribed ACE inhibitors or ARBs for his blood pressure because of the type 2 diabetes mellitus. he should stay away from things like ibuprofen. So he's prescribed acetaminophen for Tylenol. Or Tylenol for his pain, which he can wake up with headaches and things like that due to his hypertension. And that's it as far as medications go. But these two play a huge part in how they work together, because this affects this and this can affect that. So thank you for your time. If you have any questions, please let me know. Thank you.